Welcome to The Coalition. This is a talk show dedicated to discussing health, wellness, and inspiration. I'm your host, Dr. Shani Belgrave. Hello, everyone. Thank you so much for joining The Coalition. I'm your host, Dr. Shani Belgrave. I am a bariatric and minimally invasive surgeon. I'm also the founder of Onika Bariatrics and Wellness, based right here in Atlanta, Georgia. I am really excited today to welcome an esteemed colleague of mine, Dr. Zazi Nylander. Dr. Nylander is an obesity medicine doctor and family medicine doctor who's here to join the show to talk about one of my favorite topics, the importance of body composition. Dr. Zazi Nylander, thank you so much for joining the coalition.
Hi, Dr. Belgrave. Thank you so much for having me. I've been following your YouTube channel and it's been, pretty amazing and informative. So I'm happy and excited to actually be on here.
Thank you so much, Dr. Zazi. So before we jump right into it, can you please let the audience know, as a family medicine doctor and obesity medicine specialist, why is body composition important? First of all, what is body composition? What are our components?
Right. So that's a good question. So when patients hear the term body composition, what we're really talking about is breaking weight down into different components, right? And so we look at the fat percentage, the lean muscle mass, and also what we call the visceral fat, which is essentially the fat around the organs, right? That particularly is important is because that's what kind of drives metabolic risk. And when I say metabolic risk, what I mean is your risk for like insulin resistance or diabetes or, high cholesterol, those kinds of things. And this matters because, weight obviously isn't the whole story, right? And you would think, because we're talking about body composition today, that body composition is the whole story too, but that actually isn't the whole story, so it can be important to see the fat percentage, the muscle percentage, and, the visceral fat too. But more important is, even more important is also too, is function. So if you're seeing, trends in improving muscle, how exactly is that function, in your day-to-day life? And how does that translate in terms of strength, balance, energy, and how your body just kind of functions day to day?
Wow, thanks so much for that insight. I feel like now would be a perfect time to interject. I think some people have heard of kind of like the apple shape versus the pear shape. And so when you talk about visceral fat, just to make that point, that is fat that's held within the inside of the abdomen, as opposed to fat that's more subcutaneous, sometimes in women more noticeable in the buttocks and in the thighs. And so carrying excess body fat, which is the medical term for obesity, as you know, can be problematic for the health. But I'm glad you touched on especially visceral fat, because that tends to be associated with some other things. So perfect. So that's a great segue into now the different types of body composition scans. First of all, what is a DEXA? Can you kind of tell us what that is?
Right. No, that's a good question. So when we're talking about body composition in general, DEXA is usually considered the gold standard. And this is typically, what is done in research settings. And we like DEXA because it can be very precise, right, in terms of, what you're measuring. But in a real world clinical setting, when you are following patients, for example, on their weight loss journey from month to month, using a DEXA scan is not the most practical, for reasons like, cost. DEXA is a big machine, in terms of, scheduling, and DEXA can have, some low radiation exposure too. And so you don't really want, people be doing DEXA, month to month. And so, when you don't have, DEXA, other things would be bioimpedance analysis, which is another way of measuring body composition. And you definitely, in my clinic, we use the Sika. A lot of people are familiar with the in-body, for example. And the key thing is not necessarily among those which is better, but more so looking at the trend, right? So I don't want people to focus on, okay, what is my fat percentage, or what is my muscle percentage? Because then that goes us back to that, takes us back to that whole weights thing where you're focusing on just the weight. But essentially, like, what is your trend over time? And so if you're somebody that is losing weight, obviously we want to focus on trying to either maintain that muscle mass or increase that muscle mass and decrease that fat mass, right? Because that's what leads to sustainable results. Because the more muscle mass you have, the greater your metabolism, right? So that's kind of what we want to focus on, yeah. And then even actually, honestly, in my clinic, I don't use body composition just for those who are trying to lose weight, but even just someone who is trying to optimize their health, and I can think about a particular patient, where she said to me, oh, I don't think we can work on anything, right? And then we looked at her body composition, and for her age, this was a young female, her muscle percentage was pretty low. So this was something that we said, hey, we got to make sure we work on your protein intake. We got to make sure we work on your strength training to really kind of optimize your health, especially at a young age, right? Because you want to start building that muscle when you're younger, because as you get older, it just becomes harder, and that muscle mass just essentially decreases, right? So yeah.
Well, I want to thank you for co-signing on what I'm always saying every day, which is making sure that we're meeting our protein goals, and that even though cardio is great, it is important to incorporate resistance training, and to incorporate weights and things like that.
Yes.
So,
And Shani, that's a great point, because I don't know if you realize, but we used to tell people all the time, make sure you get your 150 minutes of moderate intensity exercise at least 3 times a week. But it's only within the past like 5 years or so that we started really saying, oh, wait a second, strength training is important, right? So definitely kind of important for us to always kind of think about that too.
agreed. And so, what are some things that people need to know in terms of things that can affect the results of these tests as it relates to hydration, timing of when the test is done, and so forth?
Right, right. And so, as I mentioned before, what I really try to have patients focus on with these measurements is not necessarily the exact measurement, although that can give you some information, but the trend, right? And so, if you are measuring a trend on something, you want to make sure that each time that you take that measurement, you kind of replicate those conditions, right?
Mm.
So, I would say just how hydrated you are. And so typically I like to do these tests in the morning when patients are fasting. They've come in for their physical anyway, and they're fasting. Also too, I wouldn't necessarily, have a super aggressive, exercise workout in the morning, for example, and just being consistent in the time of day. And if we pick hydration, for example, if you're super hydrated, compared to another time when you took the test, muscle holds on to water, right? And so that can affect your muscle mass and make it seem, more elevated than it actually is. So just things like that. And the key thing with that is just really just trying to replicate the conditions, the testing conditions, just kind of like you said, the hydration, how much you exercise, the time of day. Yeah. And on the flip side, dehydration, can also make muscle appear lower, right? Than it really is. And so I don't want you to, be dehydrated, do your test and then suddenly be beating yourself up over a one-off reading, right? And this is where, we say that looking at that trend really does matter.
And so, when you're using body composition scans, with what interval do you like to do those studies?
Yeah, that's a great question. Because I've heard different things kind of depending on who you ask, right?
Mhm.
And so I wouldn't do it more frequently than once a month,
That's what I said. I love when you agree with me, because some of the manufacturers will say that you can do it every 2 weeks, but to me, that's not enough time to really
Right.
track anything.
Right. Yeah, and you could even prolong it even, to maybe every 6 weeks, but really not more than once a month. Yeah.
Mhm.
Yeah, I've actually heard some pretty wild things even sooner than 2 weeks. I've heard, and that wasn't a manufacturer. That was like I think like a fitness trainer was recommending for a patient, which I think, it's just, yeah, it's just, it doesn't give you valuable data
Additional
in my,
information.
yeah.
So, what would you tell people? You kind of touched on this a little bit earlier, but what would you tell people about how to use a scale? So, with a lot of stuff that I'm doing for weight loss, um, we're looking at what tools are helpful. How are you assessing progress on your journey? And so, for some people, it can be clothing size. They're all kind of what we call non-scale victories. How would you tell people is a good way to incorporate the scale in tracking their weight loss in terms of how often to weigh, when to weigh, and
Right.
plus minus on adding in the body composition?
Right. So plus minus adding and when to weigh. So let's see, just trying to think about your question. So I would say, being, excessive about kind of how frequently you weigh, can be problematic, because, your weight kind of fluctuates, right? And
Right.
so, once every 2 weeks, once every month, I think that's reasonable. And then also too, just, that your relationship with the weight on the scale is important because not being discouraged, by weight plateaus, and this is where body composition becomes, helpful because I've certainly had patients where the weight plateaus, but we go and kind of delve deeper into the body composition and we find that their muscle actually increased and the fat composition actually decreased, right? And weight and muscle weighs more than mass, right? And so weighs more than fat, right? And so
Right.
yes, so definitely yes. So the body composition can give you more information in that, and just not being discouraged about weight plateaus because you don't necessarily know what's going on in there, right? And then similarly with weighing, just also weighing at the same time too, like, of the day. I would say kind of with your clothes off, sometimes just like with the body composition, that first thing in the morning is always good, but just being very careful in general about obsessing over that number because it doesn't tell the whole story. And like I said, even body composition, doesn't tell the whole story, even though it tells us more, right? But it's also more about function too.
Absolutely. Well, thank you so much, Dr. Zazie. What would be your takeaway message as it relates to body mass composition?
Okay. No, that's good. So I think I would say, weight loss shouldn't feel like a constant battle with the scale, right? When we understand what the body is actually doing, fat, muscle, metabolism, we're able to make smarter decisions and actually even be kinder to ourselves in the process. And that's something that we actually didn't talk about in with body composition. That I've had some patients say, "Oh, I am able to be a little bit more forgiving to myself because I kind of see more of what's going on as opposed to just the scale moving up, for example, or staying at the same place."
I love that. I love that. Dr. Zazie, I love following you on social media. For people that are watching, what's the best way that they can learn about what you do on social media?
So I think following me or my practice. So my social media handle on Instagram, pretty active on Instagram and Facebook is Dr. Nylander, but then also for my practice, Cassia Optimal Health as well. You can find us on Instagram and trying to be more active on TikTok as well, but primarily on Instagram and Facebook at this time.
Great. Well, I want to thank you so much, Dr. Zazie. You have an open invitation to return to the coalition another time.
All right. Thank you, Dr. Shani. It was great being on here with you.
Thank you. Well, everybody, thank you so much for tuning in to another impactful episode of the Coalition. I'm your host, Dr. Shani Belgrave, minimally invasive and bariatric surgeon here in Atlanta, Georgia. I'm also the founder of Onika Bariatrics and Wellness. Very special thank you to Dr. Zazi Nylander of Cassia. She is an esteemed obesity medicine doctor and family medicine doctor. You can stay connected with Dr. Zazi through social media. You can stay connected with me at www.drshanibelgrave.com. Make sure you share this episode with friends and family to spread some information on the importance of body composition, not only as it pertains to weight loss, but also to health maintenance. Thanks, everybody. I'll see y'all next time.